Hello, welcome. I'm Dr. Darren, family medicine physician, and today we're doing health education on topics that you want most. This episode is on dementia. Dementia is the gradual onset of cognitive impairment that can occur as we get older. Dementia is easily one of the worst diagnoses that there is, and it's also one of the most expensive medical problems that exist. So this is a really important topic that you need to know about. We're going to be covering the different types of dementia, how to differentiate dementia from common forgetfulness, the testing that we use to diagnose dementia, the treatment for dementia, and we're also going to speak about caregiver stress. Now, before we get started with dementia, remember that these videos are for educational purposes only. I can't give personalized medical advice here. So if you or someone you love are suffering from dementia, make sure that you go see your doctor. Now, let's get started with dementia. What are the different types of dementia? The most common type of dementia is Alzheimer's dementia, and this is characterized by the presence of abnormal proteins in the brain called beta amyloid plaques and tau tangles. These abnormal proteins interfere with the normal functioning of the brain. The next most common type of dementia is vascular dementia, and this occurs after having strokes. If somebody has had one or more strokes and as a result they've developed cognitive impairment, this is what we refer to as vascular dementia. But this may also occur in the absence of obvious strokes. And this is because over the course of our lives, we often experience mini strokes, very small blockages of blood vessels in the brain, and this can happen tens, hundreds, or thousands of times, so that over the course of a long life, even though you never remember having a big stroke that caused symptoms and put you in the hospital, you may gradually develop changes in cognition that eventually amount to vascular dementia. There are other less common causes of dementia, such as Lewy Body dementia, that often features hallucinations, and frontotemporal dementia, which often features personality changes. There are other medical problems that can also cause dementia, such as alcohol abuse and HIV infection. But again, the vast majority of dementia are Alzheimer's or vascular dementia, or a combination of these. Dementia interferes with normal brain function. And because the brain is responsible for so many things that we do, this means that the symptoms of dementia are quite broad. However, the most common symptoms of dementia are memory problems and confusion. In order to best understand the memory problems and confusion that can happen with dementia, I first want to speak about a different concept, which is benign forgetfulness. Have you ever forgotten where you put your keys and you spent 10 minutes searching your home to find your keys and eventually you found them and you remembered where you put them? Or imagine that you're walking down the hall and a friend of yours turns the corner and they're walking towards you, but for some reason in that moment you just can't remember your friend's name. Or imagine a third scenario, that you're in your home and you get up to walk into another room, and when you get there, you realize that you forgot why you walked into that room. And then later, 10 minutes later, you remember what it was you wanted to do, so then you go back into your room to do that. These examples of benign forgetfulness occur in everybody, regardless of their age, and this is not consistent with dementia, although we often see more benign forgetfulness as we get older. What differentiates benign forgetfulness from dementia is the severity of the symptoms, the magnitude of the memory problems, and the confusion. Some signs that the symptoms are becoming significant is when they're having a negative impact on somebody's life, or where it's causing issues of safety. And I'll give you some examples of this. Imagine somebody who walks out their front door to go for a walk and they can't remember how to get home. Or imagine somebody goes into the kitchen to cook a meal and they can't do it safely. They're hurting themselves. Maybe they're starting fires. Maybe they're walking out of the kitchen and the stove is still on. Or imagine another scenario where you have somebody who is trying to take their medicines properly and they're unable to do it. And as a result, they're causing harm to their body because they can't remember to take their medicines properly. These kinds of symptoms are more consistent with dementia and are not consistent with benign forgetfulness. How do we diagnose dementia? It's important that when dementia is suspected, that we order a variety of tests in order to rule out other causes and to confirm the diagnosis. And these tests include labs, imaging, and cognitive testing. The labs that we order when we think someone has dementia are broad. And this is important because there are many medical conditions separate from dementia which can cause confusion and can mimic the clinical picture of dementia. These medical problems include infections, metabolic problems, inflammatory conditions, tumors, autoimmune diseases, anemia. So it's very important that when we are worried that someone has dementia, we need to check a variety of labs, including checking the blood, checking the urine, and sometimes checking other labs via a lumbar puncture, where we can analyze the cerebral spinal fluid in someone's central nervous system. There are a variety of imaging studies that we may use if we suspect that somebody has dementia. A chest X-ray or an echocardiogram may be used if we suspect that somebody's symptoms may be from a problem with their heart or their lungs. But the most important imaging studies that we use focus on the brain. And this includes CT scan and MRI. These imaging studies can find direct evidence of dementia, such as white matter disease, or degenerative changes of the brain, or prior strokes. In addition, these imaging studies are important to rule out other problems in the brain that may mimic the symptoms of dementia, such as cancer, or a brain bleed, or hydrocephalus, where there is too much cerebrospinal fluid in the brain. Cognitive testing plays an important role in the diagnosis of dementia. Cognitive tests, such as the mini mental state examination, aim to evaluate somebody's memory and their reasoning and their problem solving. A poor score on one of these cognitive tests may be consistent with a diagnosis of dementia. The treatment of dementia can be frustrating. As of now, there is no known cure for dementia, and it tends to get worse over time. The goals when treating dementia are to help to keep patients safe, to improve the quality of their life, and possibly to slow the progression of their dementia. The treatments that we use for dementia include cognitive and behavioral therapy, environmental changes, medicines, diet, exercise, lifestyle changes, and the use of a caregiver. Cognitive and behavioral therapy can be very helpful with dementia. In this type of therapy, the goal is to help a patient understand their diagnosis of dementia and to better understand their struggles with memory and with sometimes getting confused, with the ultimate goal of improving the quality of their life. Environmental changes can play an important role in the management of dementia. We make changes in the patient's environment to improve their safety and to make their surroundings more familiar and less likely to trigger acute confusion. There are medicines which are FDA approved for the treatment of dementia, and these medicines include donepezil and memantine. While these medicines may be helpful, they may also cause significant side effects. So it's important to listen to your body. If you develop any new symptoms while on one of these medicines, make sure that you talk to your doctor right away. What can be especially challenging is that many patients who suffer from dementia may have a difficult time conveying symptoms and side effects that they may be experiencing from a particular medicine. So please use caution when considering medicine to treat dementia. Something important that I want all of my patients with dementia to do is eat healthy and exercise. A healthy diet is important for every organ system of your body, including your brain. So it's important to eat healthy if you have dementia. Eat lots of fruits and vegetables, drink plenty of water, and avoid overeating. Exercising is also really important. I recommend exercising at least 30 minutes each time, at least 4 times a week. Just like with a healthy diet, exercising is important for every organ system of your body, and it's definitely important for your brain. Something important that I want all of my patients to do who have dementia is to keep themselves mentally and physically stimulated. I don't want you to have a routine where you're doing the same thing every day because that's easy. I want you to work out your brain. So here's what I want you to do. Every week, I want you to spend a significant amount of time doing something new. So for example, you may have one week where the weather is nice, so you decide to go on several hikes that week. The next week, you may decide to spend a lot of time reading because there's a novel that you really want to read. So you read it and you discuss it with your loved ones. The week after that, maybe you decide to go swimming several times. The week after that, maybe you spend a significant amount of time doing crossword puzzles or Sudoku. These are all great activities to do to keep yourself mentally and physically stimulated. And this is an important part of managing dementia. An important treatment for many patients with dementia is the use of a caregiver. As dementia worsens, it becomes harder and harder to take care of oneself. You may need a caregiver in order to keep you safe, to help you to shower, to help you to use the restroom, to prepare food. You may need a caregiver to help you to eat. In fact, you may need a caregiver to help you to get in and out of bed, or even to move around your house. So for many patients with dementia, a caregiver can be an essential part of treatment. At this time, I'd like to speak about caregiver stress, and this is really important for all of you caregivers watching. Caregiving is really hard, and it can cause an enormous amount of mental strain, physical strain, emotional strain, and financial strain. So it's important that you take care of yourself. And if things are not going well, make sure that you talk to your doctor. Depending on the patient's medical problems, they may benefit from home health, where a nurse or a physical therapist comes to the home to provide services. In addition, you may benefit from having a professional caregiver come to the home, and this may be done through in-home support services or by hiring a professional caregiver directly. That's it for today. Thank you for watching. Make sure to subscribe and leave a comment down below letting me know what health topics you'd like covered in future videos. In addition, if you have any questions, leave them in the comments and I will answer all of them. Remember that these videos are for educational purposes only, so if you or a loved one is suffering from dementia, make sure that you go to see your doctor. Bye-bye.